So what's home health? Home health brings skilled medical care right to your loved one's home. It's for someone recovering from surgery, illness, hospital stay, somebody who's managing a chronic condition like heart failure, COPD, or diabetes. These are not sitters or general caregivers. These are licensed professionals helping meet medical needs at the home of your loved one. Typical services include nurses who handle wound care or medication changes and monitor health issues, possibly therapists, whether it's physical or speech or other kind of therapist. There are home health aides who help with bathing or dressing, only whenever it's part of the skilled nursing plan. And then there are medical social workers who connect with your family and connect them with a community that has support and benefits and maybe even some counseling. So the question is, how do you know if your loved one qualifies for home health? Now, home health is a medical benefit usually paid for by Medicare or private insurance if similar criteria are met. To qualify, there must be 5 things that have to line up. First of all, you have to have a doctor, a physician that certifies that there is a need for skilled care here and will write an order to such. There's usually a homebound requirement that the patient or your loved one must need help or considerable effort if they have to leave the home. They're basically homebound. They can't get out and go to a doctor's office. Thirdly, to get skilled care need, they've got to require intermittent skilled nursing or therapy. Not 24/7, but intermittent, usually a few days a week. Now, you'll also have to have a face-to-face visit. The loved one must see a doctor. Sometimes it's in person, although occasionally it will be done by video, to be evaluated if your loved one does qualify for home health services. And then services must come from a Medicare-approved home health agency. Now, if these 5 criteria are met, Medicare will pay 100% of your home health services. No deductible, no copay, except possibly on equipment cost like a walker or an oxygen. Some equipment is only covered up to 80%. So how do you start getting your loved one cared for at home by home health? Well, first of all, you need to talk to your loved one's doctor. You need to ask them, would they qualify for home health? Would that help them? Are they eligible for in-home nursing or therapy? If so, the doctor will make a referral, sends orders to a Medicare-certified home health agency, and you do have a right to choose which agency as long as it is somebody who is certified with Medicare. Thirdly, the home health agency will then contact you. A nurse or an intake coordinator will call and schedule your first home visit, usually within just a few days, for an initial assessment of your loved one. They will visit to evaluate the needs, the medications, the equipment, the home safety, and then they help create a plan of care with the doctor for your loved one. And then regular nursing visits begin, or therapy visits, whatever is appropriate. A schedule is set up for the visits, often a few times each week, and it tapers off as your loved one improves. Every 60 days, there's a medical review, and there has to be a recertification from the doctor that care is still medically necessary if the services are to continue each 60-day period. So what does home health cover? Well, skilled nursing, part-time, intermittent, need for a skilled nurse. Physical, occupational, or other kind of therapy needed. Medical social services, limited home health aid, medical supplies used during the visits, and most medical equipment is covered by home health. What do they not cover? First of all, they do not cover 24-hour or long-term care at home. That's not what home health does. They don't do meal delivery. They don't clean your house for you. They don't run general errands. They do personal care when it is specifically tied to the skilled need that your loved one has. But they're not going to do other things like clean the house and change the bedding or things like that. Well, how long do the services last? Home health generally lasts just as long as there's a medical need and there's progress being made. When your loved one does no longer qualify for skilled care, the agency will provide you a discharge plan, including possibly exercises, medication, instructions, and follow-up appointments. In the end, home health care is one of the few fully covered Medicare benefits that brings real medical help right into the home. And it's a partnership between you, the doctor, and your home health team to make home the best possible place to heal. But you're not alone in this. Thank you.